Hey guys, do you have shoulder pain when you're pressing in a bench press or maybe pressing overhead? Then this video is for you because we've got Kevin here today and he's having the same symptoms. So Kevin's been feeling a lot of issues with bench press, and then after his session at the gym, he'll start to get pain through his trap, up his neck, and then even down sort of on the inside of his shoulder blade here. And we've sort of run through a bit of an assessment with Kevin, and we found that he's actually got a nerve entrapment in the back of his scalenes here called the dorsal scapular nerve. Now, how this has come about has been that his shoulder mechanics are actually quite good, but we found the real issue for him was the deep neck flexors in his neck, and that's kind of like the core of your neck. So what we're going to do today is we're going to release all the muscles around here to really take the pressure off that dorsal scapular nerve so that it's not jacking up so quickly and creating that pain when he's doing his training, but then also run through the exercises that he's currently on, because we've gone on to step one, but we're going to progress him to the next level of that today as well. So you'll see the first two steps in fixing your deep neck flexors if you've got pain similar to this. So today we're going to start sort of releasing his trap muscle here. So Kevin, what you're going to do, we're going to run through some ART. We'll start with your arm up to the side here, and you're going to take it down and across as you lower that shoulder down, okay? So I'm going to hook onto that muscle and then go for it. Good. And just hold it at the bottom as I sort of stretch that muscle. Now, Kevin's actually had this injury for quite a while, so about 18 months. It actually initially came on from boxing, and then he sort of peeled back away from his boxing training and sort of got into the gym and lifting a little bit more, and he started to now notice it developing that. Kevin saw a sports specialist, a doctor, who diagnosed it as thoracic outlet syndrome, which generally when you have thoracic outlet syndrome, you'll feel sort of symptoms down the arm more so, sort of broad, like pins and needles in the whole hand. But because of the sort of location of Kevin's pain, you know, the thoracic outlet syndrome, which is an entrapment of the whole brachial plexus, it wasn't too far off the mark, but then because it's specifically through here, it makes a lot more sense for it to be the dorsal scapular nerve. So the main position that nerve gets stuck is the posterior scalenes, or the back of the scalenes. The scalenes is a big muscle on the side of the neck, and there's sort of three different positions we'll treat that in. So the first one is still sitting in this position here. So with pressing sort of motions, and if you sort of feel like the deep neck flexors are an issue, what you'll see is when you're doing bench press, you'll sort of tend to sort of jar your head forward, and you'll feel strain through the front of your neck. And that's your scalene muscles and the sternocleidomastoid, that muscle there, compensating for the weak deep neck flexors, which sort of sit deep to those muscles. So it's feeling a neck strain, even when you're doing sit-ups, that can be an indication that that deep neck flexor is a little bit weak and needs some work, and would put you at risk to a dorsal scapular nerve entrapment like Kevin's. All right, let's get you laying down on your back now. So I find sort of when the patient's supine like this, it's the best position to really hit that scalenes where that nerve's stuck. Let's sort of take that pressure down onto it there as I stretch the muscle. Good. Other sort of risk factors that can really lead to this issue developing is if your shoulder is a little bit internally rotated. So that would be generally from really tight lats, really tight pecs, bad posture. If you're sort of sitting at the desk all day, you'll sort of get that rounded sort of shoulder look. But I think for Kevin, we've sort of ran through his mobility through his shoulders. It was really sound. It was purely neck that he was sort of having the issues with, leading to that nerve entrapment. The next muscle, like I mentioned, the scalenes is a big player when the deep neck flexors is weak, but also that sternocleidomastoid muscle too. So you might want to switch sides, Ange. This one. The next muscle, now that we've released the sternocleidomastoid, we've released the scalenes through here, I want to work on the cervical extensors, just so we get that full barrel, completely treat all around that side of the neck, make sure that's sort of functioning properly. One more there. Now, given that it's a nerve issue, and it initially was like a thoracic outlet syndrome, we're now sort of specifically on that dorsal scapula, with all the nerves sort of exiting the vertebra through here, it's ideal that we give this a little bit of an adjustment as well to sort of have an impact on sort of taking the pressure off those joints and having all of this sort of change its tone and relax the pressure on the nerves. So go nice and loose and floppy there. Oh, now we'll take it the other way as well. Good. All right. We'll get into the shoulder a little bit too, just for that, old diagnosis of thoracic outlet syndrome, because the Pec Minor and the subclavius under the collarbone can play a role into how all of the tone of that's going too. So you're just going to relax that. We're going to go up and down. Let that fall. That's a bit rough in there, hey? Yeah. Good. So other major sort of risk factors for this, especially around those deep neck flexors, I think the number one thing that'll disengage how they effectively work is whiplash. So car crashes, things like that. That's really the prime sort of thing that will lead to chronic issues in those movement patterns in the neck, and why so many people have chronic pain after a car accident. Good. All right. Next step, what I want to do is get some dry needling through that trap. We're actually going to go through the trap so that it hits that scalenes as well, and then up through the neck. So Kevin, let's flip you over. So we'll start with some dry needling to his upper trap here. See if we can get a little twitch out of that muscle. It's not too bad. I think we released a lot of the tension with the initial sort of soft tissue work. And then this next one will be more important because this is sort of going through the trap and into that posterior scalenes where that nerve is a bit hung up. And then the next two will be sort of at that vertebra level where those nerves are exiting for that specific dorsal scapular nerve. Now, we're going to hit one more spot. So with pain, when you get it sort of on that inside border and up in here, the part of the rotator cuff, the infraspinatus muscle, which actually sits on the back of the shoulder blade, it can refer pain in there. So just that we're hitting, you know, that sort of referral pattern of pain completely, I'm going to also treat down into this region with 2 more needles. And we'll just let that sit for a few minutes. So it's been a few minutes, so let's get these out for Kevin. And what we're going to do now is sort of look at the deep neck flexors, that first exercise that he has been doing, and then we'll progress him into the next one that you guys can also do at home if you find that your deep neck flexors aren't working well and you feel, you know, pain in the neck when you're doing sit-ups or things like pressing as well. All right, Kevin, we might get you sitting up, facing away from me. But if you're enjoying this, guys, and you are getting like lots out of this and want to understand your injuries, please feel free to subscribe. I'm really aiming to hit 5,000 subscribers, and I'd appreciate it a lot if you give us a follow. But for the exercise that Kevin's been doing, so let's review that first step of the deep neck flexors. So chin tucks. And the key for this, you can see that he's going straight back and making that double chin. Now, Kevin, do you want to show the mistakes of if you accidentally extended in that position? So if you extended incorrectly, we do this, and that's probably the biggest fault. So you want to make sure you almost scoop the chin in, which Kevin's doing perfectly here. So this is going really well. Kevin feels a little bit of a like tightness in the front here. It's almost like a crampy type sensation. That means you're doing it correctly. Okay, so the next stage for this exercise is we do it on all fours. So we'll go on table, all fours, come around this side, Ange. We might actually go side on, because what we're doing now is that same exercise, but against gravity. So we have that nice and flat, and you're going to sort of do a chin tuck from there. Perfect. Good. And you can see that he's keeping a nice neutral neck here. He's not overly extending through that upper segments there. And so by doing that, he's keeping that flexion in that intersegmental levels there, which is perfect to train those little muscles which will act like the core of the neck. So we're going to, for Kevin and his injury, we're going to slowly treat him over the next few weeks, continually working through the traps, working through the scalenes, sternocleidomastoid, a little bit in the front of the shoulder as we progress this exercise to make sure that he doesn't get pain with his bench press and overhead pressing. Thanks, guys, and I'll see you next time.